I feel it's the light at the end of the tunnel.
I'm so excited.
It's as though Christmas came early in Colorado.
Show me where to sign. I've been waiting to do this signature for 9 months.
COVID vaccines being administered in our state, and in the next 30 minutes, we'll talk about the challenges ahead and answer your questions about how the vaccine will be handled in Colorado. And welcome back to Denver7. I'm Anne Trujillo. You asked, and we will do our best to get you answers tonight. And joining us, Colorado Governor Polis, who looked very excited, by the way, in that video that we started with. Jill Hunsaker-Ryan, the Executive Director of the Colorado Department of Public Health and Environment. Dr. Richard Zane, the Chief Innovation Officer and Chair of Emergency Medicine at UC Health. And Dr. Eric France, the Chief Medical Officer for the Colorado Department of Public Health and Environment, who this time last year was the Medical Director for Merck Vaccines for the Western U.S. So thank you all for being here. We have a lot to get to tonight. So the first question I want to pose to all of you, we heard this from so many people. How will I know when it's my turn? Who will let us know when we are eligible? And Jill Hunsaker-Ryan, let's let you take that.
Hi, Anne. Thanks. It's really nice to be with you tonight. So both Department of Public Health and Environment and local public health agencies will continue to let people know how, where, and when they can get vaccinated. As you know, that we are vaccinating the highest risk healthcare workers and highest risk individuals first. And then when we get to phase 2, which will probably be around the end of March, people will be able to get a COVID-19 vaccine pretty much where they get their flu shot. So from their primary healthcare provider, from a clinic, their local public health agency, or pharmacies like Walgreens and CVS.
So do they wait for a phone call? I mean, they literally want to know, do I sit at home and wait for a call, or do I be proactive and call my doctor's office? Do I call the, Walgreens? How do they do this?
Certainly, and we encourage people to keep in contact with their primary care provider, and we will let the public know when we're moving into the next phase and when members of the public will be eligible and who that is. And like I said, we think that's going to start around the end of March. And we will message that, but of course, people should be talking to their primary care physician anyway to determine if they're eligible to receive this vaccine.
All right, so be proactive. All right, so we know that nearly 300,000 Coloradans have had COVID. How soon after having the virus should someone be vaccinated, or are they off the priority list? Dr. Zane, Dr. France?
Well, I'm thinking of our governor, of course, who just recently had his own COVID infection. And for most, we believe that it would be uncommon to become ill a second time with COVID in the 90 days that follow your original illness. So during that 90-day period, you don't necessarily need to be vaccinated either. So if you've just been ill, you can wait at least 90 days before we'd start to say maybe your immune system is waning and it would be time for your vaccine.
Governor Polis, when do you plan on being vaccinated, or how will that work?
Yeah, well, I certainly will be, and I'll make sure to make that available publicly to people. I've seen a lot of folks on social media say, "Oh, I'll trust it when you get it. I'll get it when you get it." So I will be getting it early so we can model that. Lieutenant Governor will be getting it earlier. Diane Primavera, she's in her 70s. She is at risk. She'll be getting it hopefully in the next few weeks. That'll be public as well. We want to inspire confidence in this vaccine, and so this is a really triumph of modern science. It's highly effective. It's safe. I very much look forward to showing that we walk the walk.
And I know a lot of people are questioning the safety. So how do you assure people, without knowing the long-term effects, this all happened very quickly, how do you assure people that it is safe? And I think the follow-up question for the doctors, how soon after vaccination is it effective?
Well, I can assure you that it is safe. It has gone through robust clinical trials and phase 3 trials with tens of thousands of people in those trials. And it has proven to be very, very safe. Also mechanistically, it appears to be safe. And this technology, although not been deployed in humans, has been around for decades in the animal models, and they've been waiting for a way to deploy it. I think what's very important is that people have been talking about this vaccine being shortened or rushed. That is not true. It has been expedited. meaning that there's been an amazing amount of resources in dollars and people who've been working simultaneously to do this. And vaccine companies, after they produced the vaccine, started mass production in parallel with doing the clinical trials. And that's why it's been so short and truncated. It is not rushed in any way.
So all of you, every one of you, will receive this vaccine as soon as it's possible for you to do so.
I'm an emergency provider, and at 6 a.m. on Thursday, I'll receive my vaccine.
Everyone on this call? Is that a yes?
Absolutely. I'll be getting mine soon, and we'll put it on video when I get it. I suspect for me it'll probably be January, but we will be happy to let folks come film the needle going in my arm.
Governor Polis, you have stated the goal is to have the vaccine in arms within 72 hours of it arriving in the state. Since both the Pfizer and Moderna vaccines require 2 doses, with the second at 3 to 4 weeks after the first dose, what procedures are in place to ensure that there will be vaccine available so those who have received the first shot can actually get the second dose when it's due?
So first of all, yes, there are no Coloradans that currently are immune because of the vaccine, except for those who were test subjects. But all those who got vaccinated yesterday, today, they're not immune. They're not immune a week or two from now. They might have increased resistance in a couple of weeks. We don't know that for sure yet. There's some evidence they will. But the 95% immunity is after the second course, which is 21 days after the first, and then another 10 days for you to develop an immune response. So nobody will be immune until a month and a half after they get that first shot. That's where that 95% immunity comes in. So for every dose that is being administered, there's sort of a pair dose that will be delivered later on that will make sure that the numbers match up. From our perspective, it's certainly very easy for nursing home residents and for medical providers, but as we get to the general population, it's more of an operational challenge for us to make sure everybody gets followed up with and gets that second shot.
Sure.
That's,
And you
it's
don't want-
harder when you get to the general public.
You don't want to skip that second shot, right? And
Absolutely not.
And can
You're
you
not
get,
immune without it. You're not immune with you may have no additional resistance and maybe 60% resistance, but it's not the 95% that you want that ends the pandemic. You need the 2.
And if you've had, and this is for our doctors as well, if you've had the Pfizer shot for the first round, can you get the Moderna shot for the second one, or do you have to stick with that regimen? Dr. Zane?
You have to stick with the regimen. Current recommendations are that after you have the first shot, whichever one, Pfizer or Moderna, that you have that second shot from that same manufacturer. For Pfizer, it's in 3 weeks. For Moderna, in 4.
Okay, good to know. Another issue raised concerns people who have allergies. People worried they may have a reaction to some of the ingredients in the vaccine. So should people with, for example, severe nut allergies get the vaccine? What about those who are allergic to penicillin or amoxicillin, eggs, those kinds of things? Dr. France?
Absolutely, these people should be vaccinated. What we are aware of is that there are some folks who have a history of multiple allergies who had an anaphylactic serious allergy to the Pfizer vaccine. Our recommendations are now that if you've had any past history of a severe allergy to an injectable or a vaccine, then you are not allowed to get this vaccine. However, if you have a history of food allergy, bee sting allergy, latex allergy, even a serious one, we still want you to be vaccinated. We will ask that you sit and wait for 30 minutes after your vaccination, just so we can be sure that you're not having any kind of bad reaction. But the only real contraindication, reason for not getting it, is if you've had a severe reaction to a prior vaccine or the contents of that vaccine.
Okay, thank you for that. We know also that so many people have autoimmune issues, and that has been a main source of worry for a lot of folks. I mean, all of us have something, right? So whether it be diabetes or heart disease, an autoimmune issue, what do you suggest for those folks as well? Is this safe? Dr. Zane, I'll let you take this.
Yes, especially for those folks, it is safe and recommended.
And Dr. France, you agree as well? This is a no question on your mind?
Yes, absolutely. Again, talking with your doctor when you're thinking about getting this vaccine will be important to review your medical conditions. there are no medical conditions other than severe allergy to the contents of the vaccine itself that are a contraindication for being vaccinated.
Okay, our next question, this is another one that's been asked by several Coloradans. All right, most people understand that the vaccine can help protect them from becoming sick with the virus. They want to know, if they get the vaccine, can they transmit COVID-19 to someone else? Will people who get the vaccine still be able to spread the virus?
So for now, after someone has been fully vaccinated, the recommendation is that you continue physical distancing, masking, meticulous hand washing, because we don't know if you are protected from spreading the virus. We have to wait until there's a significant amount of herd immunity and enough of the population has become vaccinated and immune before we think about lessening those protections.
And how soon after the vaccine is it effective?
It's after the first dose, there's immunity after 5 to 7 days. And after the second dose, as Governor Polis mentioned, 5 to 7 days is when that 95% for the Moderna and Pfizer vaccines have that 95% immunity.
Because I've seen a lot of people asking, okay, so I get the vaccine, can I then see my children, or can I then see my elderly parents who I've not been able to visit with? What do you suggest?
I would suggest that they continue to follow the public health recommendations for their community. Well, there's a lot more for us to learn about the level of protection that comes with the vaccine in terms of spreading. Remember that the studies that we did were looking for preventing people from getting sick. And they weren't so much about preventing people from being asymptomatic carriers, walking around and potentially shedding it. So we need to learn a bit more about whether once you're vaccinated, is there any chance that you're potentially shedding it? We do know it's 95% effective at preventing you from having symptoms and getting sick. So while we're doing these studies, it will be important that everybody follow our public health guidance, wearing masks, staying 6 feet apart, being careful, and avoiding groups and gatherings.
Let's talk about the priority list. Jill Hunsaker, Ryan, please come back into this conversation. Talk about the process again and how the priority list works.
Yes, thank you for the question, Anne. So back in October, the Centers for Disease Control and Prevention asked all states to provide a vaccine distribution plan with priority populations. We did so at that time. We had input from the community. We worked very closely with Governor Polis, and we provided an initial prioritization plan. However, the CDC's Advisory Committee on Immunizations had not yet weighed in on their recommendations for prioritization. So they've recently done that, and we've updated our prioritization list. But really the mission of vaccine distribution and our prioritization list is that we want to save the most lives and in the healthcare crisis as quickly as possible. And it's why healthcare workers that are exposed to people with COVID-19 and those living in long-term care facilities are going first in receiving the vaccine, and then other critical healthcare workers and first responders are receiving it second. And the governor may want to comment as well, but then we have the second phase is really the high-risk individuals and those in the critical workforce. We don't have subpopulations in those groups, and we may, but we don't know how the vaccine supply will look and how quickly we will get it. So at this point, those folks are falling into one bucket, and after that is the general population.
And Governor Polis,
this is a very interesting virus from the perspective of how the impact of it on your health is correlated to age to a remarkable degree. I pore over these tables frequently, but you're not talking about this being twice as risky or 5 times as risky for a 75-year-old than a 25-year-old. It's literally 100 times more deadly for a 75-year-old than a 25-year-old. So it is just remarkable to see age as a proxy for risk. If the goal is to save lives, Therefore, it's important that you give some of those first opportunities to people over the age of 65 and some others with pre-existing conditions that put themselves at risk, much higher risk of death from this virus.
And we've had some viewers who've asked about people of color who have been disproportionately hit. How has that been taken into account in the prioritization? And some military folks are asking, where are they on the list?
So it is important when you talk about race. You are not inherently at a higher risk of dying because you are Black or Asian or Native American or white. That is not the race, the color of your skin is not a factor in the outcome. Now, there are factors associated with race that have correlations, and then there are jobs associated that have correlations with higher racial compositions of different jobs that might be more at risk. But this will be characterized by who is at risk. Whether you're Black, white, or Asian, if you're 72 years old, you are at a much higher risk of being hospitalized or dying of this virus than a healthy 22-year-old Black, Asian, Caucasian, Native American.
So that will all be taken into account as you go move along with this plan.
Yeah, there'll be extensive outreach in communities of color, because one thing that we have learned is the lack of confidence in the vaccine is highest in the Black community. And so we are working with faith leaders, community leaders to help make sure that that message of confidence that this works does not result in that we don't have a gap between communities of colors and others with regards to uptake of the vaccine available first to those at risk and then to the general public.
All right. Thank you for that, Governor Polis. Dr. Zane and Dr. France, is there anyone who should not get this vaccine?
Well, patients under the age of 16 currently should not get the vaccine. And other than the allergic reaction to vaccines, there's really no one who should not be getting this vaccine.
Dr. France, you agree with that?
Absolutely. I think one area that we'll be learning more about are pregnant women. And while we did have a small number of pregnant women in the trials, they really weren't built to test that. However, we know that a pregnant woman has a low base risk, but because she's pregnant, it's going to be somewhat higher and for COVID, having a serious complication from COVID. And so women should be speaking with their providers, their obstetricians, if they're pregnant, to say, should I consider getting this vaccine now, given the rate of COVID in my community, the fact that I'm pregnant and I'm at a little higher risk of having a complication. Currently, the CDC recommends that pregnant women, lactating nursing women should all be vaccinated. Have the conversation with their providers and feel comfortable about being vaccinated.
In fact, I'm glad you raised that, because that has been one of the questions that we've heard from a whole lot of folks concerned about breastfeeding, fertility issues. So if you could please discuss the full realm of impacts to consider for lactating moms and safety, and if you know anything about perhaps long-term impact on fertility health.
Right. Well, certainly lactating women should feel comfortable being vaccinated and continuing to breastfeed. Breastfeeding is so important that first year of life that this vaccination shouldn't keep you from breastfeeding. Of course, the vaccine itself is not alive. It's a genetic material that drives the cells to make a protein that is the protein of the virus and leads to an immune response, but it's not an alive virus. So it's not going to be spread to your baby through the breast milk. And there's no evidence there's anything to worry about. I too have heard rumors about questions about fertility with this vaccine and having some impact. I'm not sure where they've come from. Certainly there's no reason to think that would be a risk or an issue based on the science to date.
All right, thank you. So we heard from a viewer who said they're not pleased with their priority assignment given to them by the state, and they want to know, Is there any residency requirement nationally that would prevent me from receiving the vaccine in another state that gave my situation a higher priority? And then they go on to ask, what about people who travel during the winter months, go to a warmer climate? What happens to their slot? Jill Hunsaker-Ryan, you want to take that?
Certainly. So I'm not sure about the residency restrictions that other states have, but this vaccine, once people are eligible because they have a pre-existing condition, because of their age, because of their criteria of where they work, or because they're in the general public, once vaccines are made available to those folks, there really aren't any such things as slots. They can get the vaccine anytime, so they can get it, when it's first available, if it's accessible to them in their area, or they can certainly wait if they need to. Of course, we recommend that people get it as soon as possible, but there's no such thing as a slot. We believe that we'll be able to start immunizing the general public probably as soon as May or June, and so this is coming for everyone, and we will be in a situation in a few months where it will be readily available.
Okay, thank you. Dr. Zane and Dr. France, this next question is a three-parter for you. So with it being 95% effective after the second, does that mean we could still get COVID? Will we have to get a COVID shot each year like we do the flu shot? And then the third question, how long do the 2 doses of the vaccine last?
So the first question is, in the clinical trials, and the 2 clinical trials were a little bit different, those patients who did contract COVID after receiving the vaccine had no serious disease. So if you contract COVID after having been vaccinated, it is much more likely to be a milder form than it otherwise would have been had you not been vaccinated. I will ask Dr. France the other 2 questions.
Sure. Thanks, Rich. I would say ask me again in 6 months. We'll be gathering more information to understand how well this vaccine creates long-lasting immunity from COVID disease. We've been at this just this year, and so remarkable as it is that less than a year after this disease was found, we have a vaccine going into arms. Now we need to follow it forward over time to see just how long it will last. We also set up a series of very important, long-lasting safety studies, because if there are rare events that happen once every 50,000 doses, we would not have seen those in the doses and studies to date. It's only in this time period, when you're having hundreds of millions of doses, that you can start looking for these very, very rare things that might be associated with vaccination.
So there are still unknowns out there. Governor Polis, did you lose your sense of smell? Did you have any weird side effect? Glad you're feeling better, by the way. But
yeah, I fortunately was largely asymptomatic. I didn't sleep well for 2 nights, but it was probably just the worry of having COVID. I don't know whether it was the biological or the psychological. I did have some diminished taste and smell, but really did not have a fever, did not have headaches. My partner Marlon had the initial round, headaches and some feeling ill. Then we thought was on the mend, but then, as often happens, day 7, 8, the breathing issues, and that was why he was hospitalized for 2 days. Our doctor suggested he go there, and he was given an anti-inflammatory steroid. His inflammation factors were high, and that has proven to be an effective way to reduce the risk of one of the primary risks, which is not being able to breathe.
Yeah, well, we're certainly glad you're both feeling better. We have about 5 minutes left. So one other question I want to ask. Could the vaccine become mandatory? And is that legal? Is it possible? I mean, there might come a point, Governor Polis, that people want proof, before you walk into their business that they've been vaccinated. I don't know. I'm just throwing this out there.
Yeah, well, no, in the private sector, that's their business. I mean, there could very well be airlines or cruise lines that do that. We do not have any plans publicly or through law to make this mandatory, just as measles, mumps, all these shots are not mandatory. They're highly recommended. Obviously, they're the right thing to do. They're the way to protect yourself. But nobody is going to come and stab you in the arm without your permission. And the good news is, with a 95% effective vaccine, as long as we reach a reasonable percentage of the population that has that level of protection, the pandemic's over. Doesn't mean nobody will ever get coronavirus, just as today people do get measles, they do get mumps, they do get these, they're not extinct. Thankfully, smallpox is, but these others are not. But they will be rare. There's no issue in healthcare capacity. There will not be sizable outbreaks because so many people will be inoculated, and the pandemic will be over.
Although, seniors are concerned. I mean, they would like to have this vaccine tomorrow. So explain, why is it taking so long? And do we have the systems in place to get this all done? I know, again, we'd all like it done tomorrow.
We're using every dose that we get rapidly. The supply of dosage of the Pfizer and Moderna vaccines, and if there are subsequent ones that are approved, have been purchased 100% by the U.S. federal government, prepaid. And as they are delivered, they're delivered pro rata to the states. So right now, we know what we are getting this week, and I say are getting because we expect the final part of the 44,000 to arrive tomorrow, but over 3-4 days, we're getting that. We know that the first phase of Moderna will be over 80,000 for that week. We hope that is next week, pending the FDA's decision to move forward. And then we will continue to receive those two, and if an additional ones are authorized, we will begin getting supply of those as well.
Thank you for that. Okay, so we have really just about a minute left, and Governor Polis, I'm going to give you the last word to talk to people who again have so many questions about this this vaccine and what life will look like moving forward.
Yeah, I think the main thing to know is when you have the chance to get vaccinated, take it. It's a blessing. You're among the most fortunate people in the world. This won't reach the large number of people in India, in Africa for a year or two. And you might have a chance in 2 months, in 1 month, in 4 months. You will have a chance, in 4 or 5 months. Everybody in our state will have that chance by next summer. So please, when you have that chance, don't waste that opportunity by not getting protected from a deadly virus that has caused so much pain and suffering, cost the lives of over 3,000 Coloradans, over 300,000 Americans, millions globally, and we can end it. We have the tools, thanks to the triumph of modern science, and all it takes is 2 pricks of a needle, 20 days apart.
All right, well, we want to thank all of our guests for joining us for this very important discussion on how the corona vaccine will be administered here in Colorado. So thank you to Governor Polis, Jill Hunsaker-Ryan, Dr. Richard Zane, and Dr. Eric France. We absolutely appreciate your insight and your time that you spent with us tonight. We also want to thank all of you at home for joining us as well. We know you have questions, and we promise that we are always working to get you answers. You can send them to us at 360@thedenverchannel.com. So from all of us here at Denver 7, enjoy your evening. We hope to see you back here later tonight for Denver 7 News at 10.